Can you explain why patients with cancer are at a higher risk of developing blood clots over the general population?
Certainly. What I'm going to do first is just explain to people that clotting is a normal part of our body's healing process. If I were to cut myself, I'm glad that I have a clotting system which will make a clot to prevent me bleeding anymore. And as good as our body is at making clots, it's also very good at reabsorbing clots as well. So we are constantly making clots and reabsorbing them. If I took a microscope to my brain, I would see that I'm having little microbleeds all the time, which don't come to anything because the body is forming clots to stop it bleeding. And then when those clots are no longer needed, they're being reabsorbed. So we have this constant sense of flux of making clots, reabsorbing them. Now that system sometimes goes awry, and there are things that can increase your risk of having clots. Number one is stasis or lack of movement. So if you are not moving around, if you are immobile, the blood tends to sludge in the veins, usually the veins of the legs. That's why we encourage people to keep as mobile as possible. Another thing that does it is if there is inflammation in the body, or inflammation of the blood vessels, which causes the release of molecules that make the blood more sticky. And then things that can cause that would be operations, for example, or a tumor eroding into a blood vessel. And then finally, there is just having more sticky blood. They call that hyperviscosity or hypercoagulable blood. And that often happens in cancer because the cancer cells release molecules that make the blood more sticky. Now, some cancers are more sticky than others, and I think we're going to talk about that in a minute. But if you imagine those things all coming together, immobility because you're not well because of the cancer, or because the tumor is pushing on some blood vessels, slowing the flow of blood, then you've got inflammation because cancer is an inflammatory process, or you've had chemotherapy which has inflamed the blood vessels. You add on to that the cancer, you've got a perfect storm to form blood clots. Now, the other thing we know is the more advanced the cancer, the more risk of blood clots there are. Okay. So, for example, if we were to look at someone with early stage cancer, say breast cancer, for example, the risk of blood clots with curative chemotherapy may be 2 per 1,000. But someone who has got metastatic breast cancer, who is receiving chemotherapy, the risk goes up to 8%. So different stages of cancer, the more advanced the cancer, the greater the risk of blood clots.